station. This is Bobo FM.
The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
All right, welcome to the show. It is Bobo, 103.1 FM. Dane hanging out with you here, and of course, every single weekday on Fridays around 1 p.m. And sometimes we replay the show, folks. And if you do want a copy of it, you can go ahead and send us a message on our Instagram at 103.1 FM. Bobo, make sure you add that Bobo in the front of it. We do always have a special guest that join us on the show. The show is all things dedicated to HSA, by the way. And we do have people that sit in different specialties in the hospital, or maybe there is an event that they want to talk about that's coming up. Now, today, we have the pleasure. You have a new last name, Faith.
I've had a new last name.
You did?
Dave.
I don't remember having.
And we had this conversation the last time I was here.
Did we?
We did.
And I'm like trying to block that out.
Remember, I had a whole kid,
Yes.
and everything with my new husband. Yeah.
Yes, that's right. And I was this surprised by it too.
Yes.
Because I was like, how are you feeling with that? I hate to change the topic because this is not our topic for today, not marriage. But how are you feeling? How long in?
Into marriage. So we're 4 years this year.
Wow.
Yeah.
I feel bad now because
it's been a little minute.
It is.
But I will say, in all fairness, people know me as Faith Gealey. Particularly professionally.
Yeah.
But I am Faith Gealey-Rochez now.
Yeah.
So I tell people it's one and the same. I'm the same person.
Does he feel, because I'm only asking this because I'm in your situation, right? Ford is a powerful name for my wife, her dad, right? Gealey is also very much a powerful name now. Does he feel like he's battling with that sometimes? Because I feel like I'm battling with the Ford last name. No?
No, because I just straight changed the name. So I'll just have Nee Gealey, or, I on some of my professional documents, it's hyphenated, but no, he's very confident in us, so
Love that.
Yeah.
Love that. Sir, sorry to bring up your personal business on the radio.
That's fine. We're all Caymanians.
Yeah.
That's part of the
We
fun.
got to know a little bit.
And then too, for a lot of the listeners, a lot of them might be like, who is Faith Gealey-Rochez?
Yeah.
Right?
Yeah.
So for them to know it's Faith Gealey, which some people don't even know me by Gealey. Some people know me as McCoy, which is my mom's maiden name, right? And so that's always fun to explain to colleagues and coworkers, well, that's my family name. So it's just nice for people to, have that awareness.
Love that. Love that. So you understand where we're coming from.
I do.
All right, man. It's a pleasure to have Faith in here. Faith is, she loves her job. She's very passionate about it. This is definitely something that I kind of feel like is your purpose. Just the way that you do speak about it, and you're enthusiastic. I don't meet a lot of people like that in their careers.
Yes.
It's just a job to them. But for you, it just seems like a purpose. Like you are easily ready at any time to check someone if they're saying something incorrect about your field.
Yes.
And I love that. I love that. So what are we going to be talking about today?
Yes. So we are going to be talking about the speech therapy service at HSA, but specifically our neuro service that we offer. Because we are a medical-based service, and I think that's something that does differentiate us from a lot of the other clinics. We have the pleasure of being attached to the hospital.
Yeah.
And so we see a lot of those sort of neuro and those more complex neuro cases and have the skill set to meet those needs. And so we're just going to highlight that and talk about some of the new expanded services that we're also offering to our neuro patients in the community, which we're so excited about.
I'm very excited myself. And this is one of those that I'm so confident to talk about now because we're going to bring it up in a couple of minutes. But, growing up in wanting to take a job in communication and media, one of my biggest problems was speech. And I always looked at myself as like, my wife will tell you, dumb, stupid, because I couldn't say certain words. And then I started to research more. And I found out that there was a lot of on-air personalities, also a lot of anchors in CNN that struggled with the same thing. The difference between them and myself was they seeked help. So when we hear the word speech therapy, we immediately just say, well, I missed out. That's just for a child. You know, because my own son took part in speech therapy. He struggled with words also. And I said, well, I missed out. That's only for a child. But like, tell us about what does speech language therapy actually involve? And let's speak about it from a neuro standpoint too, neuro care.
Right. So I think a lot of times when people think speech therapy, they think, oh, it's just, you know, a lisp or a stutter. But it's so much more than that. We are the communication and feeding specialists. So I tell people anything from your throat to your brain, that's basically speech therapy territory. So we work with swallowing and feeding disorders, and that's a big one that a lot of people don't realize. So a lot of times we have a neuro patient who maybe they had a mild stroke, they're talking fine, and they literally will look at you and be like, why are you here? I can talk. I'm like, yeah, but can you swallow? Right? And it's like, oh, no, I'm coughing with my water, or I'm coughing with food. Well, that's why I'm here. And so, you know, a lot of people don't realize that is a huge component of the neuro caseload and working with patients with neurogenic disorders. And so, but we also, for our adult population, we provide voice therapy. That's one of my areas of specialty. So working with vocal cord paralysis, vocal nodules, the overuse, like a lot of teachers who are just using their voice a lot and just having that hoarseness of the voice.
Yeah, I heard that.
Patients with muscle tension dysphonia, where, you know, they're struggling with phonating those vocal cords. We do dysarthria and motor speech issues. So those are acquired speech disorders. So usually the result of a brain injury or some type of neurogenic disorder like Parkinson's disease or stroke. And that's when you start to have that slurred speech. So a lot of times people would have had brain injury or a stroke or some type of neurogenic disorder, and now their speech doesn't sound as clear. Maybe they sound more nasal or less nasal, or, you know, the articulation is imprecise, and that's something that we also work on. We work with memory strategies for our dementia patients. We work a lot on caregiver training for those neurodegenerative disorders like dementia, like Parkinson's, really working with families, helping them plan for the steps that are to come. You know, and for our stroke patients who have aphasia or word finding issues where they've lost an element of communication, language understanding as a result of some type of neurological injury, that's also something that we work on with adults. And then I have some adults who are like yourself. Maybe they're self-conscious, maybe they've always had a lisp, maybe they've always struggled with a stutter, but have reached a point where they're saying, you know, I maybe did some therapy as a kid, but I really didn't maximize like the benefit to it. So I'm actually interested in exploring speech again. And you know, so we have some, I guess you can call them non-traditional patients who as adults are self-motivated to try to shape some of their speech patterns so that they can be more confident speakers in their life and in their job. So we do the full gamut when it comes to adult services. A lot of times people know us for our pediatric services, but we also provide very comprehensive adult services as well.
Yeah, how old are your especially around speech therapy, how old are your adults? Like the oldest person that you've ever seen?
The oldest person I've ever seen for speech is 104 years old.
Oh, wow. Wow. Yeah, see? It's like you're never too old.
Yeah, I thought you were going to say, well, how old are you now? Like, how many years have you been doing this? I'm like, oh, you're going to tell on me?
Now, I know you said the last time you've been doing this a while. We usually do ask that question, though, Faith. Like, how long have you been working in your profession?
So I have been a speech therapist for this summer is 19 years.
Wow.
And 18 years with HSA.
Wow. Wow. And you love what you do, obviously.
I still love what I do.
Yeah.
And I think that stems from how I was raised. Like my grandparents, they always told me, you know, you don't just pick a job. Don't just pick something because of the pay.
Yeah.
You want to choose a career that if that's the only profession that you're going to do every day for the rest of your life, make sure you pick something that you love to do.
Yeah.
Because if you don't ever get a promotion, if you don't ever, you know, move past that, you want to be in something that's going to give you fulfillment every day of your working life.
Absolutely.
And speech therapy gives that to me. I love my patients. I think, you know, every patient is different. Every patient is unique. Just that connection, you know, speech therapy, the foundation to make an impact on your patient's life is to connect with them first and foremost.
Absolutely.
Right? And so, you know, just making that connection, and not just working with the patients, but in my role at HSA, you know, when I first started at HSA, many moons ago, I was the only one, and it was a service that had stopped. It was 7 years and they had not had a speech therapist. And so building back up that service essentially from scratch and being given that opportunity as a young Cayman clinician, like it's something that I never took for granted, and that I was really grateful for that opportunity. And when I look now that we've gone from, you know, having 7 physiotherapists and 1 speech therapist as a therapy services team, and now we have over 30 clinicians, you know, 20 physios, 5 speech therapists, 5 occupational therapists. Like I'm really, really proud of being part of that team and growing and meeting the needs of the Cayman Islands community. And one of the things I'm most proud of is being able to offer the mentorship that I did not have the opportunity to have locally.
Yeah.
I did receive wonderful mentorship in my university and through colleagues overseas, but didn't really have a lot of mentors on island.
Yeah.
And so the fact that I'm now mentoring the next generation of clinicians and seeing them grow and seeing them flourish and seeing them grow in areas that I'm like, okay, well, you are way better than me in this area. That's your you know, niche area. You take it, you run with it. I'm so proud of you. So I'm really, really happy that, like, as years go on, that our mentorship program that we have at HSA through their internship, HSA does summer internships. And that program has really grown into a beautiful feeder program to grow our services sustainably. And so we've taken kids from high school doing work experience to coming every summer to going through university to going through their master's or getting their PhD, depending on what area they're in, to then coming back and joining HSA as clinicians.
Love that.
And so I'm just so proud of the mentorship that I've been able to provide for the next generation of Caymanian therapists.
That's so big, because when we first, we have a personal testimony with Faith, because we went into the hospital for our son to receive. We said that earlier, for speech therapy, and I just remember we didn't get you, which kind of felt off, because I was like, well, we want Faith. That's what we were saying. We both looked at each other, me and my wife, and we were like, we want Faith. But after, and we met with the speech therapist that we're going to be working with, she basically was a representation of you.
Yes. Mm-hmm.
So it felt good knowing that you were such a good leader, that your team represented what you were teaching them, and they're going to teach the next generation upwards and keep going upwards. And I love that.
Yeah.
So I had to mention that, because it did feel kind of weird coming in, because we heard just so many wonderful things about you. So
we get that a lot still. We get families that say, like, well, I want you. And I'm like, what? I'm part of a team. And, like, I promise you, like, there's no one on our team that if it was me or my kid, then I would not trust them to provide my service. And that's my benchmark. You have to be good enough for me and my family to be good enough for my community. Yeah. Right? Yeah. And so, and I mean, and I have colleagues who have treated my kids, who have treated like family members, and that I've trusted to do a good job. And they did. You know, and so
good.
Yeah.
That's so good. I like that. And she is really a great team leader, folks. Well, what I want to ask, because I'm just hearing now that during Speech Language Hearing Month.
Yes.
Right. What do you want? What message the most do you want the public to understand about neuro rehab services?
Oh, Well, I think maybe just to have a better understanding of what it is that we offer in Cayman. Sometimes I hear, people say, well, we don't have neuro rehab services. Like my family member is struggling with this and we don't have this on island. And it may not necessarily be at, another facility, but at HSA, we do have those services. And we have a fantastic multidisciplinary neuro team. Obviously today, because we're highlighting National Speech and Hearing and Language Month, that we're focusing on the speech therapy side of things.
Yeah.
But we have a fantastic neuro team that's multidisciplinary. We have amazing physiotherapists and occupational therapists who specialize in neuro, who are just amazing at what they do. And so I think just to really let the community know that we actually do have these services, and these services are only continuing to expand because people are living longer. And what we're able to manage on island has grown so much.
Yeah.
When I was a new clinician, if somebody had a stroke, it was stabilized and sent them overseas. Now, sometimes patients don't even need to go overseas, right? And so we're able to do so much more with the expansion of the physician services. But I want the community to be aware that we also have the therapeutic arm, and then that's the arm that's with you for the long haul, right? To really try to see if we can get back any of that function that's been lost.
Yeah, I love that. We're going to list some of the services here, because what I do see here is your neuro services actually support patients from NICU all the way through adulthood. Can you list some of those services and classes that you offer for neurocare?
Yeah. So, we do offer inpatient services. And so with inpatient services, that does include the NICU, with babies who maybe were, have encephalopathy or something like that, like, hydrocephaly, something bleeding on the brain, water on the brain, like maybe they were premature, maybe they have like different type, maybe they have a genetic disorder, maybe they're just not eating and we can't figure out why, right? And so so we do offer NICU support when it's needed, and for those inpatient babies that need that long-term input, we do offer OT and speech currently. We are down a pediatric physio, but we're hoping to get that role filled soon. But that team does such a great job of following the babies. We offer Babble Boot Camp. So it's a preventative method for babies, doing a lot of parent coaching those first couple years of life, kind of coaching parents on, okay, at this stage, your baby should be doing this. This is how you model it. So we're working on that preventive intervention versus treating a delay. And so we're really excited about that service and about growing that service. So right now we're in the pilot stages where we're testing to see, even though this program is great and has great evidence base, is it great for Cayman in the cultural context? Like, do our people respond to this type of program? And so far, they have. So we're really, really excited, because it would be so great to prevent a lot of the language delays that we see coming in the clinic at 3 and 4. Moving on now to more of our adult inpatient services. We do offer services to the ICU or critical care unit, medical ward, surgical ward. So basically any patient who's hospitalized, who has any type of acute communication or swallowing disorder. And for some of our longer haul patients where they've had a stroke or brain injury and are appropriate for intervention, then we start that inpatient rehab process from the time they're in the hospital. And that's been an expansion that we've started offering from last year, and we've been so excited about that. And we're hoping to expand that even more.
I believe you guys will, because every time well, this is, I think, your second interview I did with you, and you seem to be expanding every year. Something's growing.
We're trying to, because the needs continue to grow, right? So in terms of outpatient in the clinic, we offer individual sessions, but we also offer a wide range of group sessions. And those group sessions are not only in Grand Cayman, but we also offer a neuro group at the KCCC, Elderly People's Home in Cayman Brac.
Yeah,
So we
yeah.
offer monthly services to Faith Hospital. And so I'm so excited. They enjoy it.
Yeah.
And they're like, oh, we wish you guys could come every week. They have such a good time, and we have a great time with them. And so I'm just excited that we're able to start to even expand what we're offering even to the sister islands. And so the group classes that we offer we have 2 neuro groups in Grand Cayman. So one is just a cognitive communication group, and that is patients who are either long-term stroke survivors or early to mid-stages dementia, or have had a TBI or some type of other incident that's impacted them neurologically. And we work on kind of fun, socially engaging ways to maintain communication, but using that social group environment. Then I also have a neuro dominoes group where I play dominoes with my gentlemen who have had long-term stroke. And for them, they love it because it feels like they're just playing dominoes. But, part of dominoes is smack talking and having conversations about politics or, the hurricanes or whatever. And so we just kind of like every time we shuffle, we throw a new topic out there and we're talking about it. And that group is also growing. So I'm going to have to start
I would
have
imagine
2 tables. They look forward to it. And they don't miss my gentlemen. They come so early. So I always have like coffee and like this morning I had banana bread and coffee ready for because as I was leaving, one of my guys came in and I was like, I soon come back.
It's so good.
And they love it. And it's just a way for them. And a lot of them have had, strokes. So they may have like one hand that's not fully used. So it's like a nice way for them to also like work on their fine motor skills. And it's just a way for them to feel like culturally they can still participate in some of the social activities that they do. So now a lot of them are feeling more confident on weekends to go out to their favorite haunts and play in the domino tournament and stuff, whereas before they weren't, right? And so they really enjoy it. And then our newest group is a Speak Out group. So I've recently become Speak Out certified, and Speak Out is a therapy program that's tailored specifically for patients with Parkinson's or Parkinson's-like communication issues. And so it helps patients speak more confidently, speaking with intent, and helps them to kind of overcome some of those communication challenges that patients with Parkinson's experience. So a lot of times they tend to mumble, they tend to talk more quickly, they don't have as much breath support. And part of that with the Parkinson's is that, they have that sensory deficit, so they're not aware of how their speech has been affected. And then because, it impacts the automatic functions, right? So that's breathing, walking, talking, all the things that we don't think about that we do. This approach actually teaches you how to bypass that automatic processes. And so you're able to kind of, I guess, hack your brain, so essentially, it's like a life hack, right? And it works so beautifully, and those patients can take it into like every aspect of their life, and so with that program, there's an individual component, there's the evaluation and individual component, and then there's the group session, and you're in the group session for life because Parkinson's is lifelong. And the theme of Speak Out is we're with you for the long haul.
I love that.
So you're not getting just discharged. You kind of ebb and flow as your disease progresses, and as you need, we're ebbing and flowing through whether you need that individual, whether you need the group, but we're always focusing on maintaining those gains so that you can be a confident communicator for as long as you are alive.
I love that. That's so good. And we're going to continue this conversation because we're learning a lot and more information too that I'm gathering from Faith. that wasn't even supposed to be asked, but we're learning more, and just and we hope that you want to be a part of the conversation. If you're hearing something and you want to ask a question, we've always encouraged our listeners to please go ahead and send us a message, of course, at Bobo 103.1 FM on Instagram or Facebook. We can get it to Faith, or we can get it to Monique, who works in marketing, all right? So either way, it will reach Faith at some point. So if you have any questions, just go ahead and do not be afraid to put that through our direct message. We'll be right back after this very short commercial break.
The Health Services Authority has over 120 world-class physicians offering the most comprehensive range of specialist services on island. Our dedicated team of professionals provide the highest quality care in orthopedics, interventional radiology, women's health, geriatrics, and a host of other specialist areas. We are a JCI accredited organization with a proven record of excellence. At HSA, we are committed to caring for you. For more information, visit hsa.ky.
All right, welcome back to the show. It is Bobo 103.1 FM. I am your host, Dane, for all things HSA. Today, we're talking about a very special topic this morning around neuro-speech therapy service at HSA. Faith is joining us here in the studios this morning. Thank you, Faith. Well, I should say this afternoon. It's Friday and during the afternoon time. So, Faith, thank you so much for taking some time out and just kind of breaking down your department. We love that.
Thank you.
So, Faith, before we jump right into the interview, I got to learn how to say your husband's last name, your new last name, Rochez. Yeah, I want to remember that. Gealey has always been something that we always say, but
yes.
I want to know how to pronounce your new last name too.
Faith Rochez.
Love
hailing
that.
from the West.
Yes. Are you living in West Bay now?
I am.
See, you had to. West Bay is not
West
going to
Bayers
leave
don't
West Bay.
move.
Nope.
They don't move, man. That was the thing.
East End and West Bay. They try not to, at least.
And, and my mom is part East Ender, right?
Yeah.
So my mom, when she was like,
Is she still there?
No, she lives in the U.S. now. But
Okay.
She was just like, oh my gosh, you're going to move to West
It's
Bay.
hard, yes.
Just like your Uncle Gareth. I'm like,
Yeah.
yes. But that was literally like a topic on like early first dates. It
Yeah.
was like, all right, if this progresses and, we get married, are you willing to move to West Bay?
Yeah.
Like, that was like a deal breaker question.
Yeah, man.
I was like, okay.
It is. I have a lot of friends that are West Bayers, and they
But
said
you
they're
know
not
what?
going anywhere.
I'm not leaving West Bay.
It's good.
It's great.
There's nothing wrong with it at all.
It's great. I mean, I'm a Bonnet Towner. I do miss my Bonnet Town
Yeah.
family. But I love when I have my community day. I go see my patients in Bonnet Town,
Yeah.
and so I like that I get to drive through my own neighborhood and all that. But I mean, living in West is great.
My wife is from Town, and during our dates, she mentioned she wanted to live back up there, and I was like, fine, that's great. But she said she bought the land in Northside, and I was like, I don't know.
That's retirement goals.
I don't know.
Yeah.
No,
But
we did.
Oh yeah.
We made the move.
Okay.
We made the move, yeah. 8 years in.
But it's so peaceful.
It's very peaceful.
So peaceful.
Not the traffic, but it's very peaceful. Traffic is not too peaceful. Even though we found ways now on how to make that drive peaceful, we listen to audiobooks.
Yes.
So me and the kids, and we enjoy that because now we talk back and forth on the audiobook. So it's working out.
Yes.
It's working out. We like it. We love it. All right. So Faith, before we went on a break, we were talking about, of course, the services that you offer for neuro.
Yes.
And just support that you're offering to patient. There are some more, of course,
Outpatient.
services outpatient that you want to
So I think
talk
we
about.
just highlighted like our outpatient group classes.
Yeah.
But we also offer a lot of outpatient one-on-one services. So first and foremost, we offer dysphagia assessments and treatments. Myself and another colleague are trained in multiple specialized modalities to support dysphagia. And dysphagia obviously is swallowing disorders.
Yeah.
So we are trained I'm trained in the McNeil dysphagia therapy protocol, and both myself and my colleague Emily are trained in Vital Stem, which uses neuromuscular electrical stimulation for patients who are appropriate. There are some contraindications, but when appropriate, we do use that as a modality to help support the return to swallow function. We also do a lot of traditional exercises for swallowing, and just offer a safe place to try to improve your swallow function, that you can get back to eating the foods that you love.
You say safe space, but that was important to say.
Yes.
A lot of people are embarrassed about that.
Yes.
Yeah. So
yes.
they want to feel like you're not judging
And
them
it's
when
scary,
that comes to it.
right?
Yeah.
Like if you've had a stroke and everything is choking you,
Yeah.
it's like you don't want to eat. And so we try to offer that safe space and meet the patient where they're at, but also see what we can get back for
Yeah.
that patient.
Yeah. You know, my grandfather went through that same thing. And for him, you know, somebody feeding him was a weakness.
Yes.
So it's tough.
Yeah.
I'm glad that you mentioned that. I had to stop you there. I didn't
No,
wanna-
that's fine.
Yeah,
We
the big
do
one.
have our team has put together, like we do try to put together diets according to our patient's cultural background.
Yeah.
Obviously the most popular one is the Caribbean and Cayman background. So like some of my patients are so relieved when they're like, I can, like Christmas time, I'll get calls like,
Yeah.
can daddy have fruitcake?
Yes.
Mommy have cassava cake?
Cassava,
and like
yeah.
they'll be so surprised. I'm like, yeah, but it gotta be blended and it has to be real and moist. And they're like, really? And I'm like, yes.
Yeah.
And they're like so like excited about certain things that they thought that maybe they couldn't eat. But then when I'm like, no man, you can have that, they're like,
Yeah.
oh, that's so good, you know? So yeah.
I
So
love that.
that is something that's very rewarding too, is that, you know, taking their meals and making it something like what do they like, and
Yeah.
let's see how we can let you still enjoy the taste and the flavors that you like, right?
Because you're going through this new experience, and now you don't want to be told, and now I have to cut this thing out.
Yeah,
That I
and then
really
people,
enjoy.
like, just give them baby food, and it's like I wouldn't want to eat baby food,
Exactly.
like, you know. So I tell people, like, you know, if there's no diabetes, if there's no health reason for you to adjust the spices in your food, like if dad loved pepper, make sure you put pepper in his stuff.
Yeah.
You know, like let
Yeah.
the food be tasty.
Exactly.
You know, because that's part of the sensory experience of eating. You know,
It is. You can't
So,
lose that part. Of it.
No, definitely not. We also do dysarthria assessments and treatments, and that is I referenced it earlier in the show, but that's a motor speech disorder. So
Okay.
that's often characterized by the changes in nasality, the slurred speech, imprecise articulation. So where I'm struggling to sound clear.
Yeah.
And that happens with both neurogenic disorders like Parkinson's, as well as acquired neurological disorders like strokes and TBIs, which is traumatic brain injury.
Yeah.
We also work with traumatic brain injury. That's actually one of my areas that I actually love working with, and doing a lot of that neuro rehab that comes with bringing back that function after that brain injury. So working a lot on that executive functioning skills, self-awareness, like the communication, the impulse control,
Yeah.
all the things that come with that.
I saw a guy recently that got in an accident, a really serious one, and his communication skills was definitely affected.
Yeah.
Like you had to be very patient with him when you're
Yes.
speaking with him. So
Yeah.
and that I didn't want to ask him
Yes.
about it, but I picked up on it right away. This
Yeah.
is not the same person I'm talking to.
And even changes in personality.
Yeah.
Right?
Very much so.
Which happens, you
Yeah.
know, and so.
So that's what
yeah.
you meant about the brain function. Okay, good. Yeah.
Yeah.
All right.
Yeah. So the executive functioning skills are, think of it as the operating system for your brain.
Yeah.
So those are all the skills that you need to be able to do in order to communicate, read, write, talk, like all those things. And it's things like attention, orientation, like being aware of my surroundings, impulse control, organization, like all those kinds of meta-linguistic is what we call it. So it's kind of, you need those as
Yeah.
your foundation blocks so that you can handle all the other things that are to come. And myself and the occupational therapist that specializes in neuro on our team, we work in tandem a lot with our traumatic brain injured patients.
Love that.
We also do stroke assessment and rehab. So aphasia and any other communication issues, we try to support, see if we can get back as much spoken language as possible. Obviously, with any type of neurological injury, there is a chance that damage is permanent.
Yeah.
And so we always tell families we will do our best, but we cannot guarantee. And so I often tell families, like, you know, if we're not seeing the progress, if we're not seeing things after like those first 12 months, you know, it's time to pivot. And
Yeah.
like, let's look at maybe other forms of communication, or like how can we support communication based on where that patient is at. And that's why getting early access to care is so important. Because within the first, really ideally within the first 6 months, but definitely within that first 12 months is where research shows us that we make the most progress. It's not that we won't make progress past that point, but that's where we know the brain has the most neuroplasticity after that injury, as the brain is trying to heal. And so, so we walk families through all of those things. We also do some dementia support as well, dementia assessments, more for the early to moderate stages. As they start to get into the later stages, care pivots, and it's more about, making sure that you have your home set up safely. And, it transitions more into that occupational side of things and the nursing side of things. But for those early to moderate stages, using strategies like space retrieval, which is just helping you, in a very like concrete way, try to remember like really important information that's unique to you, as well as just working with families and caregivers on ways to keep that brain busy and active and engaged, so that we're promoting that word finding, we're promoting that recall of, those safety prompts and those sort of things. So I try to make therapy first and foremost as functional and patient-centered as possible. Our goal is first and foremost is that you're safe, right? And then after that we're looking at what brings you quality of life. So like if I'm working with a patient with dementia and they are, say they're starting to wander a lot, we might be working on wife's name or next of kin's name and phone number as things to remember, and like your address, like remember where you live, so it's that important. Way if you go walk about you and somebody says, oh, Mr. So-and-so, what are you doing? Which has happened to me before. I've seen my dementia patient on the road and knew that they still remembered how to take the bus and took the bus to town and then forgot where they were, but recognized my face and came with me, and I called like family member and I was like, hey, I got him. I gave him breakfast. Like, he's good, but he's in my office. And, and so thankfully we live in a community small enough that we still can do that. But, those are some of the safety things that we also have to think about. And then, like I mentioned before, our newest program is a Speak Out assessment, which is tailored specifically to patients with Parkinson's disease. It is best for patients in the early to mid stages of Parkinson's. If they're in the end stages of Parkinson's, it doesn't really make as big of an impact. But it's nice because with the expansion of the neurological services from the physician's standpoint, we're getting patients who are being identified more in those early to mid stages. And so, it's nice to know now we have this evidence-based program that produces results and is able to support that communication for as the program says, for the long haul. So we're really excited about adding that offering.
Definitely a lot more. And it has me excited to see that you guys are growing this much. Now, something that's very talked about here on the island is, of course, strokes. That's something that we've all had to deal with within family members or friend circle. What I do want to ask is neuro events. And when that do take place, what kind of communication difficulties may somebody face?
So some of the first signs that people notice are the slurred speech, or that, in my mind I'm saying something, what's coming out of my mouth is not matching what I'm trying to say. And so that difficulty with finding words. For some patients, it impacts understanding. It can impact memory as well as attention to task, and then swallowing, like what we mentioned before. And of course, like something that I think people often overlook is the emotional mental health toll of being somebody who is independent, self-sufficient, and then having a stroke and needing caregiving support and not being able to communicate and not being able to, it's frustrating.
It's hard.
Absolutely hard. So just also supporting patients to say, hey, maybe you need to talk to a counselor as well as do speech, you know, and really empathize and support and help to identify, like, there are some mental health needs, and a lot of times because of that connection that we establish with our patients, a lot of times as a speech therapist, we're kind of the detectives
Yeah.
when it comes to some of the patient issues, and because we're the safe space that the patient feels like they can push through, they can try to communicate with us, and they know that we're not judging them, we're
Yeah.
not rushing them, we're going to sit and problem solve with them. You know, we also work with patients who've had, you know, seizures, brain tumors, like those types of
Yeah.
sort of acute neurological events as well. Because a lot of times the fallout from those tends to be similar to what you would see in a stroke or another type of
Exactly.
acute neurological event. Yeah. So in fact, right now I'm working with a pediatric aphasia, the result of a seizure. This child is doing brilliant. Like, I
Yeah.
just adore this child, and so proud of the work that the child is doing, the progress. They're back in school, like after 2 months. Like, I'm just so excited.
So good.
I'm
Yeah.
so excited,
Yeah.
like, you know, how well the child is doing, you know, and it's going to be definitely, I've told family, like, I have to do a case study. This
Yeah.
is
Yeah.
so rare, and the child is just blossoming.
It's a breakthrough
Yeah.
story.
Yeah.
You have potential tears in your eyes talking about
I
that
do.
child.
I love my patients. I
That's
really love
good.
my patients.
I love that. I love that. We always see that with you, Faith. So we love that about you. Now, I do want to kind of dig deeper into this part because this is important. What are some of the warning signs that someone may need neuro speech therapy? Like, what are some of the signs that you see and you're like, yeah.
Well, one would be, obviously, if you see any changes in your speech.
Yeah.
So are there any, and sometimes it's not necessarily slurred speech. What they notice is differences in nasality. So maybe they become hypo or hyper nasal. So it just sounds like I'm kind of muffled, like, you know, and they can't figure out why. Word finding difficulty is another one. You're noticing that you're struggling to find words. Lots of coughing and choking during meals.
Wow.
Or what I notice a lot of times too is that patients will just, by the time they come to see me, they've already adjusted their own diets.
Yeah.
Oh, well, I don't eat rice anymore. I only eat mashed potato and ground minced meat. Right?
Just
And it's like,
swallowing it, right?
yeah, because they realize that, you know, with thing, or I don't eat oats porridge anymore, only if it's blended fine, you know, like, so you start to see people naturally make those shifts. So if, say, you have a loved one who's elderly and lives on their own, you notice like, oh, mommy's not eating the same type. She's just picking. She only wants ground provision and steamed fish now. And before she used to love, you know, ribs from Chef John's.
Yeah.
Like, you know, like, you might want to dig a little deeper. And a lot of times, sometimes people just have like mini strokes, like TIAs. And so it's just barely noticeable, right? But it's just that little difference that can mean, hey, you might need some speech intervention. Definitely, if you notice any memory issues, any cognitive or communication issues, you're noticing I'm struggling with following conversations. I have changes in my voice. My voice is hoarse. My voice sounds wet. It sounds gurgly.
Yeah.
And if you have had a neurological event, let's say you had a stroke years ago, and you're fine, but then you notice that you're having changes now, chances are you had a new event. And so you don't just say, oh, but that's because I had a stroke years ago. Your
Wow.
stroke from years ago should not be causing new symptoms today.
Yeah.
Right. And so all of those are kind of signs that you might need to visit your doctor and ask for a referral for
Yeah.
speech.
That is those are some good points to consider. And I think one thing that we miss to talk about, which is very important because we do talk often about the patient, but there is a next person that's staying with you, living with you, that are dealing with the difficulties. So what do families often say they struggle with the most before therapy begins? This one is difficult.
Well,
Because
I
a
think
lot
it
of
just depends.
families here locally, and I will never speak for everybody, but I think lack of education for one around the area. This is why shows like this are important, and just empathy. Like I feel like a lot of people, because they don't understand what's going on.
they'll be like, just come on.
Yeah.
Let's get it out.
Use your words. You're better than that.
So
Like,
yeah. So typically I'll speak for things like Parkinson's. So with stroke, if it's a major stroke event, you tend to know. If it's a TIA or like a smaller stroke, and I don't want people to think TIA means a small stroke. It doesn't. But TIA is a transient ischemic stroke, so generally it may not necessarily have as much damage as, say, a hemorrhagic stroke.
Yeah.
Right. So it's just a different type of stroke. What I tell people is like any changes in swallowing, oral motor movement, communication, any changes at all, the only thing that changes that is the brain.
Mm-hmm.
So there's no other anything that impacts your speech or your swallowing other than something that happens acutely in the brain.
Yeah.
And so if you notice any changes at all, you need to first and foremost think it's the brain.
Yeah.
You know, so I tell my patients that all the time. When last week you were talking up a storm, this week you're only talking one single words, I'm sending you to A&E. Like you're going to A&E. Yeah. I'm calling the ambulance. Mm-hmm. And I'm calling ahead and letting whichever doctor's on duty know I'm sending my patient over because you're going to go because I'm pretty sure you had something. Oh, but they're just tired. Oh, yeah. They're just no. Like any changes, big or small, it's a result of something in the brain. And a lot of times when it comes to things with the brain, the earlier you access the service, the better your outcome.
Yeah.
You know, it's no different than early intervention with a young child. Early intervention with a neuro event is also equally important for clinical outcomes.
Don't sleep on it.
Yeah, literally do not sleep on it. But what a lot of families will say is, I notice I'm having to repeat myself a lot. I'm noticing my family member is mumbling a lot, and I'm having to tell him to speak up, mommy, speak up, daddy. Like, you know, I notice that they keep forgetting, they keep repeating themselves. You know, those are some of those soft signs that family members will report.
Yeah.
So.
Yeah, I just want to be careful. And the reason I brought this up, guys, is because we have to be aware that we are saving them by jumping in early, right? Yeah. Or the potential of them getting better faster, a higher chance if you don't turn a blind eye to it, because we do with a lot of stuff, and I see you guys do it with kids too. Like, nothing is wrong with my son, nothing is wrong with my daughter. They're just fine.
It.
Yeah, they'll outgrow it. We'll just study harder.
Yeah.
Study harder, and you're. I dare to say that you're putting your kid through more of a traumatic situation than ever if you're not seeking professional help on that area. You spoke a lot about. I want to make sure I get this right, Faith. We were speaking about it earlier, and HSA has introduced a Speak Out program. Can you explain more about this program? Because I can see that you're very passionate about it.
Yeah, sure. So I'm excited because it is a new program. It's an evidence-based program that is for Parkinson's disease and for similar disorders. It was developed by the Parkinson Voice Project, which is a nonprofit organization. And it was a way to make Parkinson-specific intervention more accessible for patients with Parkinson's globally. And so I'm so excited to be the first clinician in the Cayman Islands to have this certification.
Yeah.
And to offer this service to the Cayman Islands because our Parkinson's population has been growing.
It has.
And so we have a Parkinson's group with our physiotherapist who is trained in the Lee Silverman BIG program. And Lee Silverman is another program that is internationally recognized for treatment for patients with Parkinson's. So Speak Out is very comparable to the Lee Silverman program, but it actually achieves the same results in half the time if the patient follows through with all the home program that they've been provided. So when I think about our community where, you know, our community has changed, people are working until they're older, it's harder to have that flexibility to pick up your parents or your spouse or whatever to bring them to therapy, you know. So the Lee Silverman program, which is an excellent program, but does require a commitment of 4 times a week, for 12 weeks, right?
Yeah.
And then like with the Speak Out program that requires twice a week for 4 weeks.
Yeah.
You see? And so it's like, well,
Yeah, no, you're
and
right.
so it makes it a lot more accessible. You can do it via telehealth. So, it's definitely accessible, and I just think it stretches out your insurance a little bit more when you have insurance programs that say you only get 20 sessions per year. Well, if you can knock that out in 8 to 10 sessions and then transition to the group, I think that just makes your insurance benefits last longer. I think it just means that it's more accessible.
Yeah.
It's easier for you to get to treatment. We have that flexibility that after we've done the initial assessment, if you've been identified as a good candidate for that program, then we can even offer the sessions via telehealth. And so I think it just fits for what our community needs right now.
Absolutely.
And with the growing number of Parkinson's patients, I think it's just a way for us to get those patients early intervention and consistent intervention so that they can be confident communicators throughout the duration of their lifespan, right? And patients with Parkinson's can live a long time if they are very proactive with keeping themselves busy and mobile and engaged. Patients with diseases like Parkinson's or neurodegenerative diseases or acquired neurological diseases, they're at such risk for mental health concerns. It's isolating. I feel lonely. I'm not able to communicate effectively. If we think about the dynamic of how our society has changed, it's not like people are going, on weekends visiting and things like that anymore. And so what I find is that if your communication is impacted, people stop coming because they have a hard time communicating with you.
Yeah.
And so if you have a way to continue communicating confidently and effectively, then it opens up the social opportunities that you need to have that quality of life engagement, that you are stimulated and engaged and you don't feel lonely, you don't feel isolated, and you're not locked up at home because nobody understands you.
Yeah. So true.
And so so I'm super excited about this program. Already started a couple patients on the program, and so far they're making good progress, and so I am super excited about this program. And just about our expansion for neuro services, because I think at HSA we keep ourselves so busy that a lot of times we just keep our head down and we're working, and people don't often realize all of the amazing services that we're offering across the lifespan at HSA.
Yeah, so the big one to mention too, so we had to get that one in. Now, we are running out of time right now, and I want to do one question I do want to ask. I know that there's a lot of important topics. Is there something that you want to touch on before we wrap the show up?
With neurological interventions, the intervention is only as good as the buy-in.
Yeah.
So I encourage patients and families, when you're accessing neurological services, there's almost always a home program component. And so it's important that you follow through with that home program, and that you are just as committed to your journey as your clinician is, in order for you to make the most out of it. I think I kind of touched on a wide range of neuro services that we offer. I mentioned we offer inpatient, we offer outpatient. We do offer some home health as well. We kind of do community check-ins for patients who are bed-bound and not able to get out to the clinic. And that way we're able to monitor their swallowing, monitor their communication, make sure we're doing caregiver training. So we're trying to keep eyes on our patients and prevent those, acquired pneumonia, aspiration pneumonia, those types of events, so that we're reducing the risks of you having to require hospitalization later on. And so we are doing a lot with a little, and we hope to expand even more. And, just that, I just think, for people, a lot of times people, I think, write off HSA and think oh, it's not for me. It's only for, government patients. But no, it's HSA is here for the Cayman Islands community.